Each patient that enters the Community Health Management Program receives a binder, just like the one that you see in front of you. I'll go through some of the different tabs with you and show this to you. We talk about safety issues with the patient. So that's things like our ER room use plan. So this is trying to teach the patient appropriate healthcare utilization, when they should go to the ER, when they should go to urgent care, and when they should go to their PCP. We have a section on resources. So this is an example of a resource that we have. These are prescription savings cards and dental savings cards for patients so that they can get lower cost health care. We talk about preventative medicine, so that includes things like for women to do breast cancer screenings and mammograms. We teach them how to do a self-breast exam on themselves. And we do talk about a variety of preventative medicine. Our next section talks about smoking, primarily smoking cessation. We refer to how smoking affects all the different organs of your body. We refer the patient to the 1-800-QUIT-NOW line from the Kentucky state program. And we talk about how quitting can help your body to heal over the course of time. The next section we talk about activity. So this is a good example of what we talk about. We try to get patients more active in general, not sitting for more than 30 minutes at a time, working on doing flexibility exercises, aerobic exercises, just trying to get more active in their everyday lives. After this, it becomes more disease specific. This section talks about diabetes, so it's things like taking care of your feet, understanding what normal blood sugar ranges are, how to use your glucometer. We talk about pattern management for diabetes, so when to test your blood sugar and how to log that in a book to share with your healthcare provider. This section talks about diabetic medications. So if a person has a question about a medication that they're taking, they can go through and they can see for that specific medication what the side effects will be, or just special notes that they need to make about that medication use. This next one is about heart failure patients. This is good for all of our patients, really. For blood pressure, they can log and monitor their blood pressure on a daily basis. We take them extra sheets as needed. And also weight, so we try to work on weight loss with our patients. And the rest of it concentrates on things like trying to make sure that you're having a low sodium diet, you're active, you're taking medications correctly, that sort of thing. Next section refers to our COPD patients. So we talk about smoking cessation a lot, what their actual disease process is, trying to maximize their energy, emotional coping. This really kind of goes for a lot of people in our program. Chronic diseases tend to be a very emotional process. We talk about medications in the next section, and that includes oxygen for people with COPD, and how to use nebulizers correctly, inhalers correctly, sequencing, that sort of thing. I'll go back to the front. This next section talks about nutrition. So this is an example of what we talk about with the MyPlate plan. So trying to increase vegetables in the diet, cut back on carbs, eat a reasonable portion of proteins. If you want to get into more nitty-gritty with our diabetes patients specifically, we have a section that talks about how to do carb counting. So what's the correct portion of a food for what you're wanting to get for 15 grams of carbs. So we kind of help them to understand what they're supposed to be eating. This next section talks about heart-friendly foods. So primarily that's focusing on limiting your salt intake, seasoning with herbs. This one talks about eating the correct kind of fats and trying to avoid the bad fats for you. And the last section focuses on COPD-friendly foods. So specifically, similar things to diabetes and cutting back on your carbs, and trying to understand how that relates to your breathing. So we really find that patients like this binder, and we can use it as a reference tool when we go for visits. For more information about the Community Health Management Program, like us or follow us on Twitter or Facebook for the Barren River District Health Department, or go to our homepage at www.barrenriverhealth.org.